Thank you for joining us, Nathan. Nathan is a GP from the southeastern suburbs of Melbourne. So Nathan, you see a lot of people coming through clinics with chronic disease, I suppose.
Chronic disease has been an increasing feature of general practice for the last 20 years now. When I started in general practice in 1985, medicine was essentially more reactive. It was about people walking in with acute problems. You manage one or two problems. Today it's more about chronic and complex disease, and that's consistent with the ageing of the population and also the progression of Western medicine to be able to manage and treat chronic disease. So people are living longer with more complex conditions.
And what are some of the challenges that come with that in terms of the management of those diseases?
Well, it's about which guidelines do you follow. So there's an issue around what is the evidence base, and if you follow all the guidelines for all the conditions, you'll be there forever. It's around what medicines are people taking. Are they complying or adhering to their medicines regimes? Are they following other advice you've given them? They're seeing lots of other healthcare providers. There are a lot more providers in the system today, particularly in allied health, so physiotherapists, psychologists, mental health workers, care coordinators, diabetes coordinators. They're spending more time in some instances in hospitals or in other settings. So trying to bring that all together in a coordinated fashion is challenging.
Yeah, I can imagine. Do you think where we are at the moment, we're managing that well and we're able to deliver those processes as well as we can, or do you think there are areas of improvement?
Well, you can always improve. In some instances, for some people it is managed well, but in many instances it's not managed well. There's a burden of healthcare information that gets collected, which is available to some providers and not other providers. It's in some parts of the system, it's in not other parts of the system. So bring that all together in a integrated fashion so that the provider who is at the pointy end at the time the care is being provided can see the current information can at times be challenging.
Yep. So what would you like to see in future, in the next 5 years, happen to work on these improvements?
So what we need to be able to do is create systems that coordinate information, healthcare information, so that providers have timely access to that information, which means really we're talking about a world of interoperability. So if somebody generates healthcare information which is relevant to the ongoing care of that individual or to the next healthcare provider involved in the care of that individual, it needs to be easily available. So that's around how you create the information, how you transfer the information, the standards that underpin it, and the systems that display it. So a tool like Pinskier is a great example of where you can actually bring information together from various care providers. So disparate care providers who are acting as a virtual care team, bring them together and then make that information available to be shared between other relevant healthcare providers.
Yeah, great. And do you think that people that aren't necessarily working in these term care models from the outside looking in think it's more difficult than it is to integrate the care with the other health providers?
Medical records are always a little bit of a challenge. Healthcare information is always challenging and complex, and if you've got your own system, particularly if you're doing it in the pen and paper world, having to move into an electronic world can be challenging. So sometimes it's about the systems you have, the culture you have, and the attitude you have. What we as a profession have recognised though is that moving into an electronic world does enable care delivery if you can access the right information at the right place at the right time. But it means changing from one system to another, and sometimes that creates problems, sometimes it creates challenges. But ultimately, we'll all get there. We'll all be doing things electronically in the next decade or so. In the same way that we've moved from pen and paper in our own lives, and we now capture information either by email or on iPads or on computers, we've all moved on. Very few of us now carry manual notebooks around. It just doesn't work anymore.
Did you expect to see, if you step back to the start of your career, did you expect to see the industry as it is today?
Look, I had no idea how it would evolve over the last 30 years. When I started, we were using 8-inch by 5-inch cards, and you wrote very little information. The first patient I saw, the staff told me, now don't use too much of the record because this needs to last us for 10 years, a card about this big. So the first patient had a chest infection, and I wrote down urtiamoxil, and I put the date on, and I signed it. That was one line. You couldn't do that today because of the requirements around good record keeping. So we need systems that where we can easily store, capture and retrieve information. And increasingly as we move from my record to shared health records to the concept the patient has access to the record as well, it becomes a community record to some extent. It's a patient record. It probably should be patient controlled in an ideal world in many instances, but it's about having a shared record.
Yeah. So I suppose we've come a long way from having those small cards to the shared health record, haven't we?
Absolutely.
It'll be interesting to see what the next 20 years has for us.
I suspect the next 20 years again we'll move away from the card to local servers that exist in most general practices to web-based systems. So we're moving increasingly to having all that data stored on a central web server and making it accessible to other healthcare providers. It means you don't have to worry about the backups, the storage, the failover, but it creates new challenges around cybersecurity. So we need to work through those. But increasingly we'll have our records stored off-site because it makes sense.
Yeah, for sure.